So let's talk about recovery after lipedema surgery. Each patient, once again, is different with recovery. I've had patients that come in the next morning that is like, oh my God, it was the easiest thing in the world. They feel fine, they're not nauseous, they're feeling full of energy, they want to take a 2-mile walk. I've had patients being very wiped out and feeling lousy and being in a lot of pain and being quite bruised with things. So really, there's a broad spectrum in terms of what's normal as far as I'm concerned. But each person is very different in terms of their recovery. To begin with, the day of the surgery, patients will either go home with a responsible or to a hotel with a responsible family member or friend to care for them, or they'll go to an aftercare facility in a small percentage of patients who are more complicated or larger, where I want them to be monitored after the surgery. They will ooze generally fluid for the first 12 to 24 hours after surgery. They will go home that evening. Most patients are feeling quite good when I call them the evening of surgery, not in too much pain with things, not too bruised with things, not too nauseous with things, usually eating quite well. Some patients feel completely great, and there's a small percentage of patients who are in more pain after surgery. I would say about 5 or 10% are in quite a bit of pain where they're taking pain medications. And probably about 30% of patients have some bruising after the surgery. Very rarely, about 10% of patients, there's quite a bit of bruising after the surgery. Most patients don't have too much pain after the surgery. About 10 or 20% are in quite a bit of soreness and pain after surgery the next morning. Most patients aren't too swollen, but a small percentage of patients swell quite a bit after the surgery. And in terms of those things, it's a slow resolution of those symptoms of the swelling, the bruising, the pain after the surgery. The day after the surgery, I actually like activity. So if patients are feeling good, I like them to move around a little bit more. If they're feeling up to it, I encourage a 1 or 2 mile walk. If they're feeling still pretty uncomfortable and in discomfort, I tell them to take it easy the day after the surgery. Usually it's about 2 or 4 weeks after the surgery that patients are able to get back into more of a regular workout routine. In terms of the long-term recovery, and this has to do with results, again, each patient is different. Some patients look at themselves a week or 2 later, and they're like, oh my God, Dr. Amron, I look amazing. Look at my amazing results. I'm so happy with it. In some patients, it takes longer. They have more of a swelling reaction that goes on that can take longer to finally settle down. Your end results from lipedema surgery are really somewhere between 12 months to even as long as 18 or even 24 months after the surgery. Usually by a month, patients are seeing some nice improvements, and it slowly improves after that. At about the 3-month mark, most patients have about 60 or 70% of their improvement. And about a year, it's usually about 80%, but each patient is different. Some patients still, after 6 months, are still fairly swollen, and it tends to go down after that. So with regard to compression in terms of the recovery process after surgery, I think compression is a very, very important part of the recovery process. In your uncomplicated patients, wearing a firm compression garment for several weeks at least after the surgery is important, and possibly even longer in some patients that continue to swell. There is a smaller subset of patients, as I mentioned, who have a very acute inflammatory process going on that we have to be more aggressive in terms of compression therapy after the surgery. And then for very large patients, such as later stage 3 lipolymphedema patients or stage 4 patients, those patients need to be bandaged after the surgery. I currently work with several different MLD specialists in Los Angeles who are outstanding. I work closely with Dr. Emily Eicher, who's a lymphologist in Los Angeles, in terms of a lot of the care of patients post-surgically, but also many times pre-surgically too. For more complicated patients or lipolymphedema patients, I involve them in the care of patients to optimize their pre-surgical compression protocol.